My name is Chachu. I work as a mental health practitioner and an advocate for issues of mental health and mental illness. So this evening, I'm really honored to be part of this program. So we are going to be looking at what depression is in men, or in whole, we'll be looking at men's mental health. So last month, in the month of June, is always marked as the month for men mental health. So during that month, issues of or psychological issues that men go through as family men, as youth, as community members, wherever they find themselves, issues of those kinds are discussed. So I think that we are not far from June. We are still not far from June. We are just, today is just 9th of July. So we'll see how we can delve into the topics, and then we can learn, and then we can unlearn some of the things that, or the thoughts that we have about being a man. So we are looking at dealing with depression. Okay, so we are saying that everyone feels sad or low sometimes, but these feelings usually pass with time. I'm sure that as individuals, there are times where we are not happy, okay, or we are low in moods, but then we will not call that depression. Depression is actually a major mental health condition. Okay, so it says that depression is different. It causes severe symptoms that can affect how you feel, how you think, and then how you function, unlike just being sad or moody. So we are saying that it disrupts daily activities such as your sleep, your eating pattern, and then your work-related issues. So if you happen to be diagnosed of suffering from depression, your sleep pattern is going to be affected. It's either you are not sleeping at all, or you are sleeping less. It's either you are not eating well, or you are eating more. And then it goes a long way to affect your social work. So we can also say that it can affect anyone, regardless of your age, race, income, culture, or education. That is the thing about depression. Then we have the genetic and the biological, environmental, and then psychological factors all coming in to play a role for us to diagnose you of suffering from depression. So as a man, when we talk about the genetic factors, there are certain genes as individuals that run through our system. So where there's that gene running in the family, it is likely that this person can pick it from maybe the grandparents or other members of the family. So then biologically also we have certain things, they are hormones. We call them neurotransmitters, which are in the brain. So what happens is that where there's an increase or a decrease in the neurotransmitters, it can have an effect on how you behave, how you react to emotions and all of that. Then we can have environmental factors, and then some psychological factors. Environmental factors where there's divorce and other issues that surround the man. So depression is a mental illness. It's not a personal weakness. Not a personal weakness, a mood or something to simply snap out of. It is treatable. It's a condition. So when you hear these days, you talk to people and you meet them, they are like, "Oh, I'm depressed." Please, you are not depressed. Real depression is a mental health condition. You cannot just snap out of it. So we'll be looking at it. There are levels of or forms of depression ranging from mild, moderate, and then to severe. So why is the study of depression necessary? It's one of the most common mental disorders in the world, and the impact reaches beyond mood. So symptoms range from mild to severe, and then can disrupt a person's ability to carry out their everyday activities. Once we diagnose you of this condition, it will disrupt your daily activities. Then it is linked to physical illness. It is associated with increased healthcare costs and conditions like the heart conditions, diabetes, hypertension, and any other physical illness you can think of. So one serious aspect of it, which is becoming alarming also, is the fact that it is a risk factor for suicide. So depression is significant. It's a significant risk factor for suicidal thoughts and then behaviors. So male depression is a serious mental condition, yet many men try to ignore it or refuse treatment. So I think when the introductory remarks were being made, some of the speakers shared some experiences. So normally we ignore it or we refuse the treatment because of where we find ourselves or our cultural, environment. So the symptoms can differ between men and women as a result of the brain chemistry, hormones, life experiences, and then some traditional male roles that discourage the expression of emotions. So an example of a traditional role that would discourage a man from expressing his emotions is when you are a chief. Imagine they say you are the chief of this town or this area, and then like the first speaker, the MC said, you go for a funeral of a family member and then you are crying all over the place. Society will not allow you. So certain brain chemistry that I also spoke about, and then the hormones. There are the male hormones as compared to the female hormones are also different. They play differently. So you see men behave in certain ways unlike women. So like women with depression, men may feel sad, hopeless, or empty. Men may feel tired or have trouble sleeping, or too little or too much. I said that earlier. Then there's lots of pleasure in activities that they enjoy, and then they struggle mentally and emotionally with their daily lives. So there are behaviors that could give a signal that a man is suffering or battling depression. So there's problem getting along with spouse, partner, or the family. This is very common. You realize that in the house or in the home, there will be issues. There are always conflicts that they need to, settle or come to understanding to. And then the escapist behavior or excessive time at work or on sports. So he will want to escape certain situations, or rather he would like to spend more time at work. So by this time, everybody should be closing from work. It's 8:17, but this man, he still wants to be at work. He wants to stay there in order to escape the situation. Then the physical symptoms, there are complaints of headaches, and then there are digestive issues, and then there's pain. Most of the pain is unexplained. They complain of a particular pain. You run every lab, you give medications, but you realize that the pain still persists. Then there's problem with alcohol or drug use. You realize that once the man falls in this area, you realize that he tends to abuse or use substance more as a way to, curb whatever is happening. Then they become controlling, or they are violent. They become violent, and there is abusive behavior. Maybe this person was a very sociable, jovial person, but once this condition sets in, you realize that they become very irritable. The least thing they want to harm you, the least thing they are abusive, and most of the time with these behaviors, there's no sense of remorse. They do it and they don't feel anything. So there is irritability or anger that gets out of control. When it happens formally, you can just tap him on the shoulder, oh, my brother, and then it's fine. But this one, you cannot control it. Then there's risky behaviors. Some will start taking up risky behaviors like reckless driving, or, indulging in activities which he will not do on the regular basis. So these are some of the signs that you need to watch out. So depression goes undiagnosed in men normally. It goes undiagnosed in men. Now, one is because They are not recognizing the signs of depression. Whatever is happening to them, they do not recognize those signs as depression. 2, they downplay the symptoms. So let's say all of a sudden he has become moody, he's withdrawn himself from the regular society. I mean, we downplay, just leave him. We will pass certain comments, to that occasion. Then not wanting to talk about depressive symptoms. So a man, because of the fact that our cultural environment makes it that you don't talk about certain things even when it's happening to you. So you realize that he will not want to talk about his symptoms. Like he said, while he was reading the tribute, he got to a time he knew that I needed to cry, but no, you can't cry. So that is it. So male depression and suicide. So although women attempt suicide more often, men are more likely to complete it. Most women attempt suicide, and then most of them, they don't complete it. There are a lot of them. Yes, they will become dramatic. A woman who wants to commit suicide should be calling you, if you don't come, I'll kill myself, or I'm killing myself. No, the man, no. He will either not talk about it. The day he talks about it, by the time you get there, executed, done, he's gone. So the growing crisis demands urgent attention. Also, men use methods that are more likely to cause death, such as guns. Straight. Oh, he's gone. It's not now that people will come. There's a country, I've forgotten the name. What they do is that, in Ghana, at some point in time, suicide was a criminal act, but it was decriminalized. So for us, anybody who is found attempting suicide or having suicidal thoughts, we take that as a serious case of mental illness. Because we seated here, the moment you start thinking of suicide, it means you have a psychological problem. And the moment you do it, it means there's a mental problem that you are battling that perhaps it didn't come out for people to see it. So it's a serious issue. So in that country, what they do is that it is allowed. They even have institutions where they have a hotel. The hotel is actually for committing suicide. You go there, there are different types. Whichever means or method you want to use, you can have it. So when you go to the washroom, they have electrocuted the jacuzzi. So you can just go lie in, fill with some water, just press a button. You are gone. Some of the rooms have pistols that are loaded with bullets. So you can just use that method also. Some also have very sharp knives, depending on whichever method you want. So you just do it there. They call your family members. They come and pick you. What do you? Okay, so also men may act more suddenly in a moment on suicidal thoughts. Okay, and then they show fewer warning signs, such as talking about suicide. Yes, like I said, yes, some may talk about it, but most men will show few signs. They will not talk about it. They are quiet. The next minute, they are gone. Then also, they are more likely to turn to drug and alcohol use to cope with their suicidal, thoughts and all of that. So you realize that they involve themselves or they start indulging more into substance use. So 100 men die by suicide every day in the US. In the US, every day. So today, the 9th of July, we've gotten over 100 people who have committed suicide in the US. And it's real, it's true. So 4 times higher complete suicide rates than women. Men 4 times. 4 times of men will complete suicide faster than women. It is important that you seek help if you are having or going through any form of suicidal thoughts or that kind of situation. So it is important that you reach out to a close friend or a loved one, even if it is hard to talk about it. Sometimes that's the problem. We actually don't even know who to talk to. We don't know who to talk to. What happens sometimes is that people, unfortunately, they talk to the wrong people. So when it happens like that, you realize that when they talk to these wrong people and they get that kind of negative feedback, they don't want to talk to anybody again. They feel like everybody is going to, respond to them the way that person did it. So it's important that we allow men to talk about how they feel without being judgmental on them. Then talk to a minister or a spiritual leader. Thankfully, we have a reverend minister in our midst. So it is important that if you cannot even trust your friend, because let's say maybe your friend knows some of your secrets or knows you, it is important that you can speak to your spiritual leader. Could be a pastor or someone in your community, depending on your faith. Then you can also consider joining men health group that deals with depression. When you go to Accra, let me not take you even far, just Accra, we have anonymous groups. So we have a group for alcoholics, we have a group for substance use and all of that. What they do is that, like we are gathered here, we are all substance users. This man is using marijuana, this man is using shisha, the man behind is using pethidine. We all meet. The focus is to share experiences. We share experiences and then we learn from each other's experiences. So when there's a new person who is now getting involved or getting into that act, sometimes when they join, they listen to the experiences people share. They take a cue from it and then they refrain. Because sometimes the experiences or the stories they share are very horrible. Some of them go through a lot. Recently, there was a video circulating on Facebook. It was this young lady who was hooked on drugs. I think Legon student. And Legon, yeah. Some mental health advocates met her in town. And they showed old pictures of this girl. And when you see the state in which she is now, God, it's very terrible. So that is it for that one. Then for the group. So when you meet in the group, you share experiences and then you learn from it. So also we have a suicide crisis center online. But when you come to our setting like this, people play or joke with those things. Just like the way somebody can just call 911. Then do, hello, there's fire. Where is the fire? My pocket. Hello. So in Ghana, sometimes there are prank calls. Somebody will make a call, I want to commit suicide. Okay, where are you? They will tell you, the place they will mention to you, they realize that this person is joking. But there are actually call lines that you can call and then you can actually get help. Then it's also important to make an appointment with your healthcare provider or professional. So here, what is important is that the thing about mental illness or psychological problems is that family support is very key. Because at the time when you are going through this crisis, you have no control of yourself. Because if you have control, you wouldn't be doing some of the things that you are doing. So family support is very, very key in management and treatment of mental illness and then men with suicide. So we are saying that get help when you need it. Asking for help can be hard for men, but without treatment, depression isn't likely to go away and may get worse. It is very difficult for men to ask for help. Even if a man is financially, if he needs some money to buy something, it's very difficult for him to ask his friend, the other male. So the same thing applies. When they find themselves in that situation, it's difficult to ask for help. But then once it is depression, it will not just go away like that. You definitely have to go through some form of treatment. Definitely. So untreated depression can affect your health, career, relationship, and then your personal safety. I know people who were in certain relationships and today they are no more as a result of certain mental health conditions. Not depression per se, but certain mental health conditions. I know of some facilities who have staff with mental health conditions, and then to some extent, some of them are not even coming to work again. Some of them, you find them even on the streets. So it will affect your health, it will affect your career, and then your personal safety. Your personal safety in the sense that once you get to that stage and then there's something we call hallucination. You start hallucinating, you start hearing voices, you start seeing things that nobody sees. Then the voice tells you that walk out. Let's say 12 a.m., 1 a.m. The voice tells you that, yo, you just walk out, just be going. I mean, there can be a drunk driver or someone driving, and then this is where it affects you personally, your personal safety. You can be knocked by a car, and then that might be your end. So depression, even if severe, usually gets better with medication, counseling, and then talk therapy. So some of the people with diagnosis of depression, I mean, they're very mild ones. Some people, their depression is as a result of, let's say, lack of funds. They don't have money, or there's no job. Get this person some money or job, it's fine. So for these people, what we do for them is that we have counseling or psychotherapy sessions for them. We counsel them on ways or means that they can get something to do for themselves, or we try to support them or link them to people who can support them. So the social welfare also plays a role. Then with the people who have the severe forms, where they are hallucinating, where they are aggressive, where they have suicidal thoughts, we give certain medications. We call them antipsychotics. So we use antipsychotics to treat people with depression. It comes in different forms and different types. Just like there are normal medications like people with diabetes and hypertension also take. And then we have some forms, some also come in the form of injection. We give some in the form of injection. The very severe ones, we use injections and then the orals. So also, it is a sign of good strength, not weakness, to ask for advice or seek help when you need it. Most of the times, or mostly, once you start asking for help, it means you are weak. In the Christian setting, even some people will say that your faith in God is low, or you don't have faith. Once you start talking about things like this, it means hosemelasio. So people will not want to talk about it. But this goes beyond faith. In the Bible, there were some of the men of God in the Bible we can talk about. We can talk about Elijah. We can talk about even Jesus Christ. Jesus Christ, at the point when he was going to be crucified, he said, or he wished that if it be the will of God, this cap be taken off his head. So it means he also went through some form of psychological anguish. So you don't have to see it as a weakness or a sign, a sign of failure. No, it is something, it's a medical condition that can happen to everyone. So we are saying that talk to your healthcare or mental health professional today. Many effective treatments are available. Don't try to deal with male depression on your own. The results could be harmful or tragic. So there are some coping skills that men can actually adapt. So with a mental health professional, treatments can help you to learn how to track your emotions and coping strategies to improve them. So we can actually help you to track your emotions. You should be able to tell when you are feeling some way, when you start experiencing certain signs, or you are feeling certain ways, or when you start having certain thoughts, then you know that you are getting there. So there's a man just on Tuesday, he used to come to the facility himself, but that day he called me and said he wanted me to treat him in the house. So apparently what happened was that when I asked him, he said he started noticing those signs or the things that happened to him, and then they bring him either handcuffed or in a very bad state. So we can help you track. So it means that he's been able to track his symptoms, and then he can tell when to go for help or to seek help. Then also manage stress through meditation, mindfulness, and then problem solving. Many men actually go through a lot of stress. And the other aspect is that we do not manage our stress. We don't do anything about it. We take it as a normal life scene. But stress these days is doing a lot of miracles. Stress is doing a lot of miracles. People come to the hospitals, we run all labs for them, everything is fine, but they are sick. You ask them, okay, you go and rest for some time. Take some leave off work. Give them some 4 days or 7 days, they are fine. So it's important that we manage our stress. These days, I think lately Trafalgar established, or they opened a center at the where they were keeping the COVID, where they were treating the COVID cases at the time. I don't know, when off the Aplau Road. So they have a wellness clinic where they have music therapy. So you see people go there, they leave work, everything. They are in a very relaxed state. They listen to music. Some, depending on the genre of music that you prefer, you get it, and then it's making or it's helping a lot of men. So you also adjust your thinking and try to approach new situations. There's a way that you handle certain stressful situations. But it's important that as men, we can try new approaches. If you realize that particular one is not working for you, if it's alcohol you have been using to manage your stress for a long time, you see that you are doing it, but still it keeps going. It's important that we look at changing the approach. And then you clarify what matters most, and then you set realistic goals and prioritize goals. So it's important to have a scale of preference. No pressure. These days, there's a lot of pressure on the male child. Our colleagues, our friends are, I think last year, Richard Niyama, RNQ. You know him, right? He organized a 40 years birthday party. I'm sure you all saw it. You saw the pressure. So some of us, when we're approaching 40, we are like, hey, this guy, the bar he has lifted, what are we going to do? I mean, that shouldn't be a pressure to you at all. We are all different. We are different people. You shouldn't let someone's pressure make you go through that. No. Just do what you can do at a time, and then you move on. And you set realistic goals. You are a civil servant. Your salary is, let's say, 3,000, 4,500. You set goals. You want to build a mansion. You want to have a swimming pool at the top. You want to do this 3D. No, please relax. Take it easy. Okay? Set realistic goals. Because some people, once they target that's what they want to do, and they are not able to do it, then what happens is that in the brain, I spoke about some neurotransmitters. They tend to start to play. So when there's this imbalance, then you see him the next time, he's moody, or they said they saw him walking on the street, he's talking to himself. That's what happens. So seek emotional support and build social connection. I think this is a very healthy social connection. So it is important that you build healthy connections or groups where you can talk about some of these things freely without any reason to be afraid or ashamed. Then it's important to stay active, keep a regular schedule, and make healthy choices. Well, myself, I don't also do it. But when you go to Accra these days, you see a lot of people, they go out at dawn, especially on Saturday. They go in groups, some go in as individuals. They are keeping fit. They are doing some form of exercise. All of these things, it will surprise you. They really work on the brain. So it's important that we keep fit. We stay on a regular schedule. So on a regular schedule in the sense that some people, you will be like, oh, as for this month, hey, I'm going to the gym. Giddy. They will start. First week, today, Monday, they go. Tuesday, they are there. Wednesday, if you call him, Charlie, you know, go. Charlie, me, that's it. He can't go again. Okay, so it's important to keep the schedule and then maintain it. It is rather a sign of strength to ask for help. Hello? It is rather a sign of strength when you ask for help. You don't have to face depression alone at all. You don't have to face depression alone. So, talk to somebody, talk to the right people, seek help, and help will be offered. Thank you very much. Okay, so we will take questions. We'll take questions. Question time. I'll urge the ladies to also ask questions, because depression is for both gender. Okay, it's not just a man's thing. No.
Please, if you have a question, kindly put up your hand.
Thank you. That was a great presentation. How do you tell a man, if you've seen all the signs you just mentioned, a man to go and maybe ask for help? The basics. Ask. I think you should go and ask for help. How do you tell your man that?
Okay, thank you. You know, she's stressed on it. A man.
A stubborn one, of course.
Yeah. So it is important that when you are dealing with people who have even not even depression, people who have psychological problems, it is very important to approach them in a very calm manner, non-judgmental. Hello, non-judgmental. So when you realize all these things that I've spoken about, you approach this person. Oh, Mr. So and so, I think that maybe lately you've not been too fine. I've been observing you. I mean, I care about you. I've been observing your movements, your activities these days, and I realize that there is something going on. I mean, do you mind to share with me, first of all? Because you have seen it, he has not confirmed it to you. So do you mind to share with me? I mean, based on whatever he's thinking or however he feels about what you ask him, he can tell you. Now, people, we are Ghanaians or blacks, we are very judgmental. So imagine the man tells you, he starts and like, normally he will not just start like that. There will be a lot of sighing and all of that. I knocked a man. I was driving. I knocked a man and then I ran away. Hey! Ewi! You killed him. You know, that kind of, once you give this kind of feedback, you have judged him. Whatever is left for him to tell you to even help him, he's not going to open up. So you don't have to be judgmental at all. And then it is important to ask questions. There's what we call open-ended questions. You don't use the close-ended. Use the open-ended. So open-ended, it gives him room to talk. It gives him room to talk. Oh, so how do you feel about this? He will talk. When you go, so you did this, you actually did this, you killed this man, and you ran away. You either say yes, no, and that's it. How do you feel about it? What happened? I mean, it should go in that direction. Now, when you do it, it may or may not work. Where it does not work, then you fall on the health professionals, or sometimes you can talk to somebody who he respects in the society, someone who he listens to. As men, I think we all, even though we all like, we are like this, there's someone, when they say that, hey, Mr. Atichokbi called you, he says he wants to see you tomorrow morning, you will humble. So you can report him or discuss it with Mr. Atichokbi, you will call him and then he can handle it. If that one also does not work, at a point, what will happen is that the symptoms might be getting worse. So when you come to us, there's a way we also come in and then we can help. Sometimes we do it against their will or their wish. Because if we realize that the state in which you are is harmful to you yourself and then the community, you know, your actions can be harmful to the community. There's a man, I don't know if it's the right place to say it, but so if we see you in town, we have been seeing this gentleman in town, and then he carries sharp knives, or he has a log or a wood he carries around, and I mean, it is harmful to he himself and people in the society. So we come in. Sometimes we even involve the security services, the police. They also come in to help.
Please, any other question? Question, suggestion, you want to add something to it? Okay, Mr. Chachu, I think they don't have, so please ask us.
Please,
and our point who will answer.
Hello. There's a hand. Okay.
Thank you very much. So my question goes like this: it's with regards to the last point at the back. So how do we break the stigma around men asking questions with mental health. That's my question.
How to break the stigma?
Yeah.
Okay, so like we are doing here, we are advocating that mental health should be something that it should be a normal thing. Like the way we talk about hypertension. I mean, if we are talking about hypertension, I don't think people will feel so bad about it like that. The way we talk about malaria, the way we spoke about COVID-19, and then sanitizer and hand washing was all around. It is important that we talk about mental illness or depression freely, without stigmatization, without pointing fingers. I mean, sometimes what we do is that sometimes when somebody even wants to marry in a family, and then let's say someone has ever suffered a psychological problem, they'll tell her, hey, that family, hey, hello. They tell you that family, there's madness. That's the term they use, but we don't use that term. So once we start talking about it on a level like this, you feel free to talk about it. When you go to the Western world, I mean, I've met or I've spoken to some of people living with some of these conditions. Some of them come down for treatment. Actually, when you go to Accra, some come down for treatment, and they can tell you everything that happened to them. They tell you the habits that they are involved in. But here in Africa, Ghana, they hide. They hide to do it. Someone is even smoking, he will go and hide. The white man, he'll do it in public. You see it. He can talk about it. So it's important we talk about it openly like this, without pointing fingers at people or using them as examples. So in a church, the pastor is preaching and then you use one person who is suffering mental illness as example. No. Once you do that, you can't break the silence. People will be quiet about it.
Thank you very much.
All right, thank you. Welcome.
Okay, thank you very much. This particular session, it's a very important one for many reasons. I used to say, many are mad or all are mad, few are naked. Mental health is everybody's business. The line between sanity and insanity is extremely thin, and you may not know. One of the ways we can actually help ourselves is to maintain the bro code. Sometimes it's interesting that the one that calls to check on you most is the one who is in the soup. Mental health will not actually inform you. And sometimes it's very difficult for you yourself to make it up. So we need a community of support. We need to create a safe net for ourselves, for everybody else, in order to be able to ensure that people don't off their candles. I've seen many candles go off. I've seen many people are tempted off in their own candles, and it keeps happening. Many accidents that we see on our roads are actually a suicide, a topic that nobody is discussing. But these issues are not just things that should remain in this room. It should be the gospel that we should all carry out there and save the male. If you save a male, you save a family. You are not just saving a family, but a community. That do not mean that the women do not matter, but because they are superheroes and they are stronger than us, so I'm not talking about them today. Thank you.
Thank you very much.
All right, so take the last one and then we'll go on to the next section.
Okay, thank you so much. So when it comes to mental health, most people do spiritualize. Mostly in our communities, we say that this is coming from this and that and that. How then do we find a way that, in as much as we are spiritual people, we really look at it from maybe the medical side and an emotional side more, or even as we talk about the spiritual side? Yeah.
Thank you. So just as there's a thin line between sanity and insanity, is a thin line between the medical aspect and the spiritual aspect of mental illness. So in our society, this part of the world, we attribute most of our mental illnesses. Even these days, not just mental illness. These days, our spiritual leaders will tell you that even if you have headache, pray. There's nothing physical. And I believe in the spirit world. I believe in spirits because I have seen people before who were fine. They had an argument with someone and the person said, you see. I've seen it. I've seen a lot of them. Now, when those kind of cases come, the family is very sure. They tell you, oh, he was fine. He just had an argument and the guy told him, we are now 3 days. And 3 days, this is the person. So truly, there is the scientific aspect where I spoke about imbalance in neurotransmitters. I spoke about the biological, the genetic, the environmental, and all of that. Some of these factors, what they do is that they predispose you to suffer a mental illness. So let's say, as we are all seated here, we all can suffer mental illness, okay? But then our predisposition, whether environmentally or our lifestyle, so all of a sudden, I start smoking, I start doing marijuana or anyone I want to do. Yes, somebody will tell me I've been smoking since senior high, nothing has happened. The truth is that you have not gotten to the point yet. There's always a point. So, and sometimes these people too, there are certain minute behaviors, small things they do which are abnormal that people don't see. So we think that, oh, he's been smoking since SHS and there's nothing happening. But when that guy or that lady is hearing voices, you won't hear it. When he's hallucinating, you will not know. So he will tell you he is fine. Sometimes you see them talking to themselves. Sometimes you will not see it. When I start isolating myself, they are all signs. The fact that you are not walking on the street like that man or that woman we have been seeing doesn't mean that you don't have a psychological problem. No. Remember, we have it from mild, moderate to severe. You could be in the very mild state. So everything is fine. You are going and coming. The day you cross the line, then everybody will see it. Now, what we do is that we do a combined therapy. So sometimes in our setting again, people will straight away carry the person to a prayer camp. And all they are doing is prayers. All they are doing is prayers. Yes, I said prayer works. But then it's important to combine the two. You don't just keep your family members at the prayer camp. They chain them. They say they are driving the spirits out of them. I have pastors in this town who, after they've done the spiritual side of their healing, they call me, I come in. I have clients like that. The pastor will call you. Yes, it's true. There was an attack and all of that. They see that, they do it. But then the person is exhibiting certain physical signs that medication is responsible for. So they refer those people to us and they are fine. So it's important to combine the two. Add your faith to it. Whatever faith you believe in, add it to it. Add it to the treatment, and then it's fine. Please, is that okay? Is that okay? So let me ask this question. Mostly we say that mental illness is or cannot be treated. People don't believe that mental illness is treated. Do you also subscribe to the same thoughts? People say it can. They will tell you, hey, even no be higher cry like, oh yeah. So mostly there are people who have gone even through rehabilitation. We have confirmed them. We are like they are fine, but people still have that thought that no, yeah, you can say it's fine. We have heard you. It's okay. We have heard you, but at the back of, we know that this guy, there's still something. So they keep watching out. When, let's say, the person is even happy, normal happiness. So please, there's actually treatment. Some can be treated and it will go away. Some are managed. We manage it like we are managing diabetes and hypertension. Thank you very much. Last one. There's another hand at the back. There's a lady.
Yes, so I happen to be in association, or oftenly I meet people that when you guys are having conversations, the kind of things they throw at you is crazy. You can't have a simple conversation and it will be normal. The things that comes out of them, you'll be amazed. And some of them too, when there is an issue, the way they think about the whole thing,
Yeah.
when they voice it out, it's amazing. Is it also a sign of a good mental health?
So you see, your ability to even know that there's something wrong with you is a good sign. Hello. Your ability to just know that, hey, I think these days my thoughts, my mood is a good sign. Now there's something we call insight in mental illness. There are some clients or patients who do not have insight, and these are the most difficult people to treat because one, he doesn't see anything wrong with himself. When you tell him he's not fine, he said you are the one who is not fine. There have been a time we were in the facility. They brought a patient. I think we lost sight. We were carried away. We left the syringe with like a loaded pistol. We left the syringe with medication. The guy picked it and said, "Hey, Abi, you say I'm sick. You are the one sick, so you also come for the injection." You can imagine how that day was like. You have to kneel down and beg this patient. Okay, so yes, where the person is doing it like that, there may be times it might be coming rampant. I mean, we all crack jokes and we laugh and we go. But this one, his jokes some are becoming offensive, some are becoming embarrassing, some are becoming, out of way. Once it starts like that, there's a problem. It might start like a joke, but then once it starts getting serious, abusive, embarrassing, then no. There's a problem. Yeah, there's a problem.
All right. I want to answer the question you asked earlier on, and I believe it's curable,
Yeah.
both spiritually and physically. And I also want to say that God bless you so much for the work you are doing. And I want to appeal if you can extend this to our churches, and this will go a long way to help us. God bless you.
Okay, thank you. God bless you too. As for the churches, well, for those who are hearing it, I think I've been to Dela Cathedral with him, and where's the lady? With one other lady. We have been to Dela Cathedral. We do it. We go to other, social institutions, the banks, the other social institutions. Yes, when we are called, we go. Sometimes we are not called, but we go. There are times we go on radio. We go to the senior high schools because these issues are very high over there. This suicide we are talking about, I have handled students of Mauli Mauko with suicide. So, it's a whole issue. It's a national issue. It's not even for adults anymore. No. Now you meet a senior high. Back then, me, when I was in SS, I don't think I've even heard the word suicide before. But now, a girl who is in first year senior high tells you, I want to go somewhere. I want to leave. I don't want to be here again. I feel like taking my life. And there are some of them, what they do is that they write. Some of them, when I give you the kind of things they write, when you read it, you'll be scared. Some, you feel like the person is possessed with some kind of spirit. The kind of things they write, the names they give to things. There was one girl who told me she talks to the sun. Imagine a client coming to tell you, she talks to the sun. And when they come, sometimes they portray certain appearances, and then sometimes their counselors are even scared. So, my sister, we will take it up. As we are doing here, you are also learning. So there's a responsibility also on you to go out there and talk about mental health and mental illness. But I'm available. I can share my contacts. Once you want to do anything like that, you can just give the call. And so my contact is 054 287 1109. 054 287 1109. And then the WhatsApp number is 027 607 9073. 027 607 9073. Thank you very much.